The Kenya Medical Practitioners, Pharmacists and Dentists Union has decried that universal healthcare is a political dream that will never be achieved in the country under the current circumstances in the healthcare sector. While addressing the media in Nairobi, KMPDU Secretary General Dr. Davji Atela faulted the government for failing to invest enough in the healthcare.
Reality on the ground tells a different story. And on the ground, I mean Kenya and 47 counties. Despite the double intention and promise, it has come crystal clear that Kenyan UHC dream remains a distant aspiration, plagued by systemic challenges that render it unattainable in the foreseeable future. We say it's a political dream. The state of healthcare in the country has deteriorated than ever before.
The team insisted that one of the ways healthcare challenges will be solved is by the country instituting a health service commission. The union said after 10 years into devolution, there is a need to conduct an audit on the status of health sector in the country.
Aspiration conference I attended, and the success stories being told there, you wonder whether they are talking about the health system that we do know, being the people on the ground and the implementers and the people who are supposed to actually be the witnesses to the development in the health sector.
The healthcare union is concerned at the lack of appointment of any medical professionals, further stating that despite Kenyan universities continuing to churn out more doctors yearly, there is still a lack of sufficient healthcare personnel in the country as the graduates remain unemployed.
That we were supposed to employ 12,000 healthcare workers each year. That is not the unions asking. It is what the government had committed to WHO to do, so that by 2017, we would think about implementation of universal health coverage. By now, we have not even employed the 12,000 that we were supposed to be doing annually.
It is quite paradoxical that in a country that has a shortage of doctors, that will take about 50 years to reach the WHO recommendation of the ratio of 1 to 1,000, has a number of doctors that have graduated wallowing in the families and wallowing without work. We have a number of medical officers, we have a number of pharmacists, we have a number of dentists, and also we have a number of clinical officers and nurses that are employed in a state where there's a severe shortages in the hospitals.
The union has called on the government to prioritize healthcare, further noting that devolution has weakened healthcare delivery across the country in the last 10 years, adding that the county governments lack the resources and capability to handle the health docket.
Tumekuwa na donda sugu katika sekta yetu ya afya tangia tulipoenda ugatuzi, na tunapotaja hivyo tumekuwa katika migomo zaidi ya 100, na jambo kubwa ni kwamba tulipogatuliwa sekta ya afya imekuwa haina ile ambayo tunasema coordinating center yenye ambayo inaweza kusaidia ili kwa ajili ya kufikia kiwango cha juu ama kuweza kuangazia matatizo ambayo yanayokumba wana afya.
In the 2023-2024 budget, the Health Ministry received an allocation of 141.2 billion Kenya shillings, down from 146.8 billion Kenya shillings in the financial year 2022-2023.
Despite the promises being kept, the health budget for health has been cut from 247 billion to 217 billion, despite the fact that we are now hell-bent on employing more community health promoters. So with an increased expectation from the health sector, coming with a reduction in the rations, we term that as lopsided allocations, and that's 1 year later.
Of the allocation, 116 billion would go to the Medical Services Department and 24.6 billion to the Public Health Standards, while 4.9 billion would go towards health research and innovation, 1.8 billion Kenya shillings to health policies, standards and regulations, and 15 billion to the health resources development and innovation. Stakeholders in the health sector have called for urgent action to address persistently low government budget allocation to the healthcare as seen in the financial year 2023-2024 allocations.
Kwamba leo hii tunapokuwa tumesimama hapa tukiangalia ile budget ambayo imewekwa na serikali kuu na hata zile ziko katika serikali ndogo, hazijaweza kuangazia ili kwa ajili ya kutatua matatizo yale yaliyopo ambayo yanakumba Wakenya.